Hello, everyone, and welcome to our training on handling, storing, and disposing of hazardous waste. My name is Timothy Smith, and I'm going to be your trainer today. Before we get started, let's go over some helpful tips so that you can be successful with this course. First off, this training has been approved by the Texas Early Childhood Professional Development System, otherwise known as TechPEDS, so please make sure your personal TechPEDS workforce ID number is on your Tim the Trainer portal before you complete your assessment. That way, your certificate of completion will automatically be uploaded into your personal TechPEDS account. If you have any questions about this training or any of the trainings that we do on our website, or if you need more information beyond the scope of the training material, there are 3 different ways that you can reach out to us. Number 1, on our website, timthetrainer.com, in the upper right-hand corner, you can send a direct message, or you can email, or you can call, and we will respond to you in a timely manner. Last, childcare regulations requires that all trainings be completed in a reasonable amount of time. So basically, you cannot complete more clock hours of training in a single day than the total number of hours that you worked in that day. Definitely, you cannot complete more clock hours of training than there are in a waking day. We always want you to be in compliance with childcare regulations, Texas Rising Star, and all of the other regulatory agencies that we have to keep happy on a daily basis. So let's go ahead and get started with handling, storing, and disposing of hazardous waste. In an early education setting and in after-school programs, one of our primary responsibilities is to keep children healthy. There are a lot of requirements on health practices, creating an environment that is healthy for young children. You're going to be using a lot of different chemicals in order to disinfect and sanitize your program. In addition, there are other times that harmful chemicals may come into your program, and not just chemicals, but other devices that may not be safe or healthy for children. This brief training is going to go over some practices that you can do in order to keep a healthy environment. But what I really want you to do as you listen to this material is really reflect and think about past practices. What are you currently doing now? And what can you do in the future to maintain a healthier environment for not only the children, but for you and all of your coworkers as well? So we have 3 different learning objectives that we're going to focus on in this particular training. First, we're going to identify hazardous materials in early education environments as well as after-school programs. We're going to demonstrate safe handling of hazardous materials and proper storage procedures so that they are always out of the reach of children. And lastly, we're going to apply appropriate disposal methods so that you will stay in compliance with not only child care regulations, but federal guidelines set forth by OSHA. We really want you to understand not just the child care minimum standards, but the overall federal guidelines when it comes to handling, storing, and disposing of hazardous waste. So, what is a hazardous waste? You might be asking yourself, I took this job so that I can just care and educate young children. I didn't know that I was going to be handling hazardous waste. Well, yeah, there's a lot that goes into this right here. So when we're sanitizing and disinfecting, when we've got pest control, when we're washing hands and using hand sanitizer and operating some of the electrical equipment that we have in our classrooms and other areas of our program, there's actually quite a bit of hazardous material that you've got to take into account in your early education program. Not to mention the hazardous material that will come out of our bodies that will come out of the children's bodies, right? So you got to really think outside of the box on this one. So any material that poses a risk to the health or to the environment, that is a hazardous material. So common examples that we typically see in child care settings and in after-school settings would be your cleaning supplies, paints and solvents that you may have in your program, medical supplies such as gloves whenever you're changing diapers, gloves when you're handling bodily fluids, when you have a significant event and blood is involved, you've got blood, and then you've got bandages. That is considered a hazardous waste. And then batteries that are operating electronic devices and aerosols that you may spray in the air to try to cover that diaper smell, or, bodily odors or things like that that come into the program. These are all examples of hazardous waste that we commonly see in our early education setting and after school programs. So let's identify some of the hazardous materials that you most likely have in your program. And look, this video is going to be a brief video about handling, storing, and disposing of hazardous waste. There's going to be some homework assignments for you before you complete your assessment to get your certificate of completion. And that homework assignment is going to involve you going around your program, identifying these items, knowing where they're stored, where they should be stored, where they're not being stored, and identifying different ways that we can keep the children and the adults safe from hazardous materials. So first off, if your program is still using bleach products, bleach, even when diluted, is a hazardous material. Disinfectant. So if you're not using a bleach product, which is allowed by child care regulations, and you are using an alternate chemical to sanitize and disinfect your program, an alternate chemical that has been approved by the Environmental Protection Agency, and you are using it based on manufacturer's instructions, it is still considered a hazardous material and must be kept out of the reach of children. We got to be really careful with aerosol sprays. Not only is an aerosol spray a hazardous material, but you could have children and adults with asthma have a reaction to these chemicals when they are used in your environment. There are many, many factors that have to be taken into consideration when using an aerosol. Paints and markers. Now look, I talk about this in so many of my trainings. When you're ordering supplies, when you're ordering equipment and furniture that is being used in your early education setting and after school program, always make sure that you're buying this from an establishment that specializes in commercial products for child care centers and after school programs. That's how you can ensure that they are safe for the children, they are safe for our environment. You still need to check, all right? But they're most likely going to be safe. When you go out and you buy paints and markers from retail establishments in your community, you're trying to save a buck, you're not thinking about, oh, I didn't order this from, an online service, I got to get it here quick. You might be bringing in paints and markers that are hazardous. Even with a situation like Amazon, Amazon is a supplier and they are supplying not only commercial businesses, but homes that are unregulated. You even have to be careful ordering items from something like Amazon because you may not be getting something that is safe for our particular environment. Again, I strongly encourage when you're ordering paints and markers and other supplies and equipment for your program, it needs to be ordered from an establishment that specializes in commercial use and specializes in licensed childcare programs and after-school programs. You've got to be safe with this one. We also have medications. We have powder, creams, and ointments that parents are sending into our programs. Just because a parent sends it in doesn't mean it's safe. So you have the responsibility of ensuring that anything that comes into your program is not a hazardous material and a risk to the children. There are so many people that think, well, the parent sent it in. It doesn't really matter if the parent sent it in, okay? If it's hazardous, you got to take precaution to that. And of course, medication should always be locked up and be kept out of the reach of children. We want to be on top of that. I'm going to refer you to our training on administering medications, and we will go more into proper storage of not only medications, but powder, creams, and ointments in that particular training. But for here, I do want you to realize that this is a hazardous material. And then, of course, bodily fluids and contaminated items. You know, we also have a training on our website on preventing and controlling illnesses that come into our programs. You know, you could make a long list about the bodily fluids that we deal with on an everyday basis in our program, whether it's, spit or urine or feces, vomit, the list just goes on and on. Blood, mucus. There are lots of bodily fluids that we deal with that are hazardous. And especially when we're talking about blood, blood is a hazardous material and has to be dealt with accordingly. And look, it doesn't matter how high quality your program is. It doesn't matter how good of a teacher you are, how good of a director you are. We're working with young children. You're going to deal with blood. You're going to deal with bodily fluids. That's just a fact. All right. So knowing how to properly handle these, how to properly dispose of bodily fluids, this is a big part of your job. So let's talk about safe handling procedures. When you are dealing with these hazardous materials that we just discussed, okay, always wear gloves when possible. Now, child care regulations basically says you must wear gloves when you're handling a bodily fluid that could potentially contain blood. Well, in my opinion, pretty much every bodily fluid that you deal with could potentially contain blood. And blood is not always visible to the eye. I always encourage early educators and individuals working in after-school programs to always wear gloves when dealing with bodily fluids. Same thing with chemicals. When you're working with different hazardous chemicals, whether it's a sanitizer or a disinfectant, always wear gloves to protect not only the environment and the children, but to protect you. Now, depending on your own personal health status, you may need other types of personal protection equipment. PPE stands for personal protection equipment. And this could be things like a mask, a shield, other items that may be needed to keep you safe. When you are using an alternate chemical to sanitize and disinfect, you always want to make sure that you follow manufacturer's instructions exactly as directed. Never, ever, ever change the directions when mixing a disinfectant or sanitizer. Follow the manufacturer's instructions. Sometimes when you've got a lot of illnesses going on in your program, you've got hand, foot, and mouth flying around, you got the stomach bug going around, people tend to want to supersize it. It's like, oh, I got to get rid of this illness in my classroom, so I'm going to supersize the disinfectant solution, right? Don't do that. You always follow the manufacturer's instructions. If you don't follow the manufacturer's instructions, you could end up with children with chemical burns, adults with chemical burns. You could end up with people having asthma reactions, a hard time breathing. There are lots of things that could happen if you don't follow the manufacturer's instructions. Y'all, if you take anything away from this training today, this is like the number one thing that I want you to take away. Always follow the manufacturer's instructions exactly as directed. Don't ever change it for no reason. Avoid mixing chemicals too. I have definitely seen this done in different programs. Once again, it's usually when there's some illnesses going around. You're trying to keep the program healthy. So you think, oh, I'm going to become a chemist and I'm going to mix this and mix that. Once again, this could have a very harmful reaction that could really, really affect bodily injury to all of those that are involved in these situations. Don't mix chemicals, all right? When you do have a spill of a bodily fluid of a hazardous material, you need to clean it immediately and properly. If that child vomits in the classroom and you're taking the kids outside onto the playground, they'll sit there and go, oh, well, I'll clean it up whenever I come back in. No, it needs to be cleaned up immediately, and it needs to be cleaned up properly and disposed of properly. Don't ever let hazardous material sit, all right? Especially if someone is entering a room unaware that there has been a spill. There's a lot of harm and there's a lot of risk right there. And then anytime you do have a significant event of a chemical spill or a hazardous waste that has dramatic impact on your program, there are very particular reporting responsibilities that need to be done in that particular manner. We'll talk about those more here in just a little bit. Let's talk about some safe storage guidelines right here. When you're dealing with hazardous materials, so once again, the most common thing here are your sanitizers and your disinfectants. They need to be stored in their original labeled containers. Look, I know how some of you are. You want the pretty, organized, theme-related classroom, and you want your fancy bottles, and you want everything to match, and you want everything to look cozy and comfortable and pretty. I get it. I understand it. But when we're talking about taking a hazardous material out of its original container and putting it in something else, that is creating a lot of risk. All right? You should always keep hazardous materials in their original containers with the manufacturer's instructions listed. Hazardous material should always be kept out of children's reach. And again, I get it. You're sanitizing and you're disinfecting all day long. And there are a lot of other responsibilities that are happening at that same moment. So it is very common for early educators to take that disinfectant and just set it down so that they could, intervene in a situation with children, right? Be careful where you set that stuff down. It needs to be safe and out of the reach of children at all times. Use locked cabinets and storage rooms. So if you've got cabinets in your classroom, you've got safety locks that you can put on there. Make sure that they're in those locked cabinets, inaccessible to children. When you do have a significant situation where you're having to use hazardous materials to clean up a spill, such as vomiting, such as diarrhea situation, you want to make sure that there is proper ventilation so that you can get an adequate amount of fresh air coming into the program. This might mean opening a window only if there is a screen on that window. It may also be opening up a door just again making sure that it doesn't create a hazard for children to wander away from the classroom and out of supervision. But talk about in your program how you're going to ensure proper ventilation in some of these situations. All right. And then make sure you're separating incompatible substances. So if you do have two chemicals that should not be mixed together, make sure that you're storing those in separate places. Refer to your leadership team if you need more information on the chemicals that you are using in your particular program that should not be mixed or stored together. When we are disposing of hazardous material, make sure that you're aware of your child care regulations, your child care minimum standards, as well as any city ordinances that you have on proper disposal of hazardous materials. Now, typically in a licensed child care program or after school program, you're sanitizing, you're disinfecting with your approved chemical. You may have some vomit, you may have some diarrhea from time to time. You may have small amounts of blood from minor injuries. These just need to be sealed up in a plastic bag, tied off, and they can usually be placed in your normal everyday dumpster. Now, if you have a massive spill where there is a more than normal amount of hazardous material, more than normal amount of blood, then of course you're going to need to call a particular third-party institution to come and dispose of those materials properly. Make sure that the trash cans that you're using, the designated disposal items that you're putting those in, are always covered and out of reach of children. Again, when you have an excessive amount of hazardous material, blood or other chemicals that are being disposed of, more than what you would have on a daily use, there are very particular medical waste bags that are red, that are marked with hazardous material, that you will use in those situations. Now, again, I just want to stress that these are extreme circumstances that you would use this. Everyday classroom use, you're going to be just fine. We never encourage you to pour chemicals down a drain. So they need to be disposed of properly. If you're needing to get rid of gallons of chemicals that have been expired or no longer being used by your program, then you will call a third party and company to be able to come out and dispose of those. But don't just pour them down a drain, because as you know, plumbing and drains breathe. They kind of like burp. That's a good way to describe it. That could actually contaminate the airflow of the room when you pour large amounts of these items down a drain. And then once again, if you're disposing a larger than normal amount of hazardous waste, there are some documentation procedures that you need to follow. You're going to be documenting exactly what you're disposing, how much you're disposing, what was the original intent behind the chemical, and the reason why you are disposing it at this point. And that would be documented and filed accordingly. So maintain your up-to-date safety data sheets. So in a licensed child care program and after-school program, this is going to be your daily checklist for sanitizing and disinfecting, making sure that you've got documentation that you are sanitizing and disinfecting as needed to stay in compliance with child care regulations. You are required to have this particular training, handling, storing, and disposing of hazardous waste, every year. And then every single new employee that is hired by your program has to complete this training. And then once again, it has to be done every single year. That's how important this is for us to understand the proper way of handling, storing, and disposing of hazardous waste. If you do need to create a disposal log, if you do have an investigation by OSHA, then you're going to keep all of those reports on file. Hopefully, you and your program will never have to deal with this. These, again, are on significant situations, but not to say it can't happen to you, all right? And then make sure that you're doing annual training, not only on handling, storing, and disposing of hazardous waste every year, but I encourage you to do a complete training at least 1 year in a staff meeting on health practices straight out of the child care minimum standards. We always want to make sure that we are maintaining a healthy environment for the children and for the adults that we care for in our centers. So, again, even after this video ends, you're not done with your training yet. All right, there's going to be some homework assignments for you to look at your individual facility, okay? There are a lot of things that I can't train you on in these videos, like where are hazardous materials stored in your particular program, right? I don't know that. What types of chemicals are you using? Are you using bleach products, or are you using an alternate chemical that is approved by the EPA? And what are the manufacturer's instructions for those particular chemicals? That's not anything I can cover in these videos. So here are some things that you need to review in your individual program before you complete your assessment. All right? So first thing, I want you to kind of identify at least 3 hazardous items that you deal with on a daily basis in your program. Now, I'll give you a little heads up. Vomit, diarrhea, sanitizers and disinfectants, batteries, right? So there are several items that we have talked about in this training that you can easily identify that are present in your individual program. I want you to have a conversation with your co-teachers and your leadership team about safe storage of disinfectants and sanitizers. Once again, whether that's a bleach product or an alternate chemical, but where are you storing these in your program? I want you to talk about the use of gloves. When are you using gloves? When are you not using gloves? When should you be using gloves? And then how do you dispose of those gloves? These are all things that are specific to your individual program that I need you to discuss. What type of documentation is required in your individual program? Do you have a checklist for sanitizing and disinfecting? At what times of the day? When do you sanitize and disinfect? And I want you to talk about when there is a spill of hazardous material, again, whether it's vomiting or a child wets their pants or has an accident in their pants. How are you cleaning this, and what type of documentation is being required by your program? And then if you do have a significant spill of hazardous material, is there a third party that your program has designated to call for disposal of that, or have they not dealt with this yet? All right, so again, I know that this training is required for all new employees. This training is required every single year, but I do want to just throw some thank yous out there. Thank you for paying attention to this. You are helping keep the children and all of the employees safe. Okay, I encourage y'all to stay informed, stay compliant, and always handle hazardous materials with care. If you have any questions about the information that we went over in this training, or if you need more information beyond the scope of the training material, you can message me from our website You can call, you can email. We are always here to help support you. Thank you, everyone, for completing this training on handling, storing, and disposing of hazardous materials. It's time for you to do your homework assignment. Go identify all of those items in your individual program. Thanks a lot.